A stroke is a sudden, life-threatening event that occurs when the blood supply to part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. But what actually causes a stroke, and why does it happen? To understand this, it's important to know a bit about how the brain and its blood vessels work. There are two main types of stroke: ischemic and hemorrhagic. Ischemic strokes are by far the most common, accounting for about 85% of all cases. They happen when the arteries that supply blood to the brain become narrowed or blocked, usually due to a blood clot. This blockage might occur within the brain itself or in the arteries leading to it. The most frequent cause of these blockages is atherosclerosis, a process where fatty deposits, known as plaques, build up on the inner walls of blood vessels. Over time, these plaques can harden and narrow the arteries, making it harder for blood to flow through. Sometimes, a piece of plaque or a blood clot forms and travels through the bloodstream until it gets stuck in a smaller artery in the brain, cutting off blood flow. This is called a thrombotic or embolic stroke, depending on where the clot forms. A less common, but often more deadly type of stroke is the hemorrhagic stroke. This occurs when a blood vessel in the brain bursts, causing bleeding into or around the brain. The most common cause of this kind of stroke is high blood pressure, which weakens the walls of blood vessels over time. Other causes include aneurysms, bulges in the blood vessel wall that can burst, and arteriovenous malformations, which are tangles of abnormal blood vessels present from birth. There's also something called a transient ischemic attack, or TIA, often referred to as a mini-stroke. This is a temporary blockage of blood flow to the brain. While the symptoms are the same as a major stroke, they only last a few minutes to hours and leave no permanent damage. However, a TIA is a serious warning sign that a person is at risk for a future stroke. Several risk factors increase the likelihood of stroke. Some of these are things we can't change, like age, gender, and family history. Strokes are more common in people over 55, and men are at slightly higher risk, though women are more likely to die from a stroke. Certain ethnic groups also have higher risks due to genetic and lifestyle factors. However, many risk factors are related to lifestyle and can be controlled. High blood pressure is the single most important risk factor for stroke. Managing blood pressure through diet, exercise, and, if necessary, medication can dramatically reduce stroke risk. Smoking, excessive alcohol consumption, diabetes, high cholesterol, obesity, and lack of physical activity all play significant roles in increasing stroke risk. Heart conditions, such as atrial fibrillation, can cause blood clots that lead to stroke as well. Infections and inflammation of the blood vessels, as well as certain blood disorders that make the blood more likely to clot, can also contribute to the development of stroke. Sometimes strokes can occur for reasons that aren't clear, even after extensive medical investigation. Understanding what causes stroke is the first step in prevention. By recognizing the risks and taking steps to manage them, many strokes can be prevented. Early detection and medical intervention are crucial. Knowing the warning signs, such as sudden numbness or weakness, confusion, trouble speaking or understanding, vision problems, dizziness, or severe headache, can save lives and reduce the long-term effects of stroke.